GE's CT can be utilized to do what's called a virtual colonoscopy. So colon cancer is an extremely important disease, and early diagnosis of a colon cancer is well known to improve prognosis and clinical outcomes. So better not to get colon cancer, but if you do, you want to know about it as early as possible. GE's CT scanner is able to do what's called a virtual colonoscopy. By doing that, you can actually identify if there is colon cancer in a non-invasive way.
Sometimes when you do a screening colonoscopy, you can identify a polyp, which is basically some abnormally growing cells. There can be a continuum or a certain progression toward cancer. Sometimes there's mild atypical cells growing, and sometimes they're just right at the stage before becoming cancer, and we call that high-grade dysplasia. Patients at average risk should have a colonoscopy at 50 years of age. However, two important factors come into play in patients getting a colonoscopy before them. One of the greatest risk factors for getting colon cancer is a family history. Patients who have a first-degree relative, like a mother or father or a sibling, who have colon cancer at a younger age should have their first colonoscopy 10 years before the age that they were diagnosed with cancer. Also importantly, newer recommendations recommend that African Americans have their first colonoscopy at the age of 45. Colon cancer screening really is such a nice avenue of treatment that we can provide for the patient because it can prevent advanced cancer and prevent even surgery. And that's really the goal, is cancer prevention.
When clinicians work together to provide integrated and well-coordinated care, ultimately the patient benefits. As a physician, I am thrilled when I see this happening.
I am a two-time cancer survivor, and I've had prostate cancer diagnosed and an intestinal cancer diagnosed, and because of the types of cancer, we proceeded with the intestinal cancer first.
Bob's case is a testament to how advanced technology can really have a life-saving effect on patient care. Bob originally came to us with an elevated PSA and a positive prostate cancer biopsy. We utilized a 3 Tesla MRI to further stage his disease. We're lucky here at DMH to be able to have 3 Tesla MRI that is more accurate in the staging of smaller tumors, particularly prostate and rectal cancer, that is not available everywhere. At the time of Bob's prostate MRI, we are also able to detect an abnormality in his rectum, which is posterior to the prostate, which led to further workup and a colonoscopy, at which time a rectal cancer was found. Bob then was able to undergo a PET CT utilizing our molecular imaging technology to more accurately diagnose the overall extent of his disease and lead to the most appropriate treatment plan.
DMH offers all the modalities, so we don't have to ship or transfer our patients for part of our care elsewhere. So as in Bob's case, we were able to provide him a PET scan for prostate cancer, and that's when we saw the abnormality in the sigmoid colon, which is the last portion of the intestine, and that's where subsequently we found the cancer.
The team was very thorough in terms of making sure that they looked at everything and considered my situation.
For you, we were able to do both the surgeries with the robot, Da Vinci robot. So there were minimal invasive surgeries, small incisions, better recovery. It was challenging, but we stayed laparoscopic, and with the robot, we got your cancer out.
When the news came that the cancer hadn't traveled beyond the intestine, I think Dr. Singh was as happy as anybody in my family. I mean, just, you know, we were high-fiving and everything. At that point, I just felt like we were family. I often ask myself, how did I get so fortunate? You know, how did I get so blessed? So it sort of gives you a new way of looking at things. And my message to people all the time, I see people and they ask me how I'm doing, or, you know, what's new with you, and I tell them, I said, you need to get your tests. You need to make sure you're doing that. You need to make sure you're on schedule, because I was really shocked 2 times.